right, welcome back to ABA exam review and the continuation of our BCBA practice exam series. This is exam number 7, and we're continuing with another set of questions. If you're new to the channel, welcome. If you're returning, welcome back. Please subscribe for all of our updates. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass the exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Following a functional behavior assessment, you decide you are going to attempt to reduce how often your client asks for snacks during the day. It is now a health concern according to the doctor. While taking baseline, the data are initially in a steady state, but then start to demonstrate a decreasing trend after 2 weeks of data collection. What should you do? All right, you are the behavior analyst in the situation, and it's a what should you do question. In the what should you do question, it is very important we understand the information given. Now, our strategy is to always understand the question first before going to the answer choices, and especially here. So what do we know so far? Well, you do an FBA and you say you're going to reduce, very important, how often your client asks for snacks during the day. It's a health concern, so clearly an issue. You're taking baseline and the data are initially in a steady state. That's great. When you're taking baseline, you're hoping for a steady state. If the data are in a steady state for an extended period of time, you're now ready to introduce the intervention. However, after a while, you now start to see a decreasing trend after 2 weeks. So what should you do? Well, what's your goal? Your goal is to reduce how often the client asks for snacks. If your baseline indicates the behavior is reducing, what's your next move? A, the data were in a steady state, so you should begin the intervention. Now, had you begun the intervention while the data were in a steady state, that would have been totally acceptable. But you didn't. You kept taking baseline, which is fine, and now the behavior is decreasing. So A is no longer applicable. B, you have been collecting baseline for an extended period of time, so you should start the intervention. That's not necessarily true. This might be true if you've taken baseline for a long period of time and the data are very variable. Then maybe you can say, okay, let's just try the intervention. But that's not the case here. The case is the data are already decreasing. So what should you do? Well, you should continue taking baseline. There's no reason to intervene right now. Your goal is to decrease the behavior. The behavior appears to already be decreasing. Why would you interrupt that by introducing a variable? What you should do is continue to monitor through baseline data. And then D, you should reassess your goals using a functional behavior assessment. Well, again, not necessary. It looks like your goal is already on the way to being accomplished, which is great. If that's the case, continue monitoring. If the data start to increase or they steady out, then you can reassess. But as long as that behavior is decreasing and you're meeting your goal, there's no further action needed. Continue to monitor and then reassess. The task analysis identifies 8 steps to starting a fire. The leader of a group of Boy Scouts plans to teach them how to start a fire using these steps. It is essential that step 7 happens very shortly following step 6, or the fire will not start. What should the Boy Scout leader use to address this? Now, if you're fluent, which you should be, fluency is the most important piece to this exam, you likely could predict the answer here. And there are many questions as you get more fluent that you're going to be able to predict. That is a good place to be. What do we know so far? We know there's a task analysis for 8 steps to starting a fire. The Boy Scout leader wants to teach the steps to a group of Boy Scouts, and it's very important that step 7 happens shortly following step 6, meaning if step 7 doesn't happen quickly enough after step 6, well, the fire will not start and the chain is not going to be effective. So what can we do? What strategy can we use to ensure that one step happens in an amount of time following another? A, forward chaining. You can obviously teach using forward chaining, but a simple forward chaining strategy isn't going to address the issue at hand. Remember, always ask yourself, what is your goal? What are you trying to accomplish? Same as B, backwards chaining. Also a reasonable strategy. It's not going to address this piece, which is the important part. What they need to do is use a limited hold. And with a limited hold, you can set an amount of time that step 7 has to happen following step 6, or the chain doesn't count. It's a good way to encourage quickness or a set amount of time between steps. And in this case, it seems like a very smart strategy. Now, what about an interruption strategy or a behavior chain interruption strategy? Well, we're not there yet, right? With the behavior chain interruption strategy, we need our learner to have already mastered the essential steps. We're not there yet. We're just starting to teach. So the interruption strategy doesn't make a lot of sense here. To accomplish our goal, remember, we have to remember, what is our goal? Our goal is to limit the time between step 6 and 7. So to limit the time, we could use a limited hold. You explain an extinction procedure to your client's parents. They're excited to get started, but ask you what they should do if spontaneous recovery were to ever occur. What should you tell them to do first if it were to occur? All right, so you've got a parent training question, and we need to do what? Well, we need to explain to the parents how to respond if spontaneous recovery were to occur. So, what is spontaneous recovery? It's when an extinct behavior suddenly starts to happen again. Okay, it's very common. We can anticipate it. And so, this parent group or these two parents are very smart to ask about this. And you should feel lucky if your parents are asking you questions like this. So, if you do get this question, what should we do? Let's say the behavior one day comes back. What should you tell them to do first? Keyword here is first. Remember, these words matter, right? That's why we spend so much time in the question. We can't skip over that word first. It's very important. A, ignore all behavior and contact you immediately. Now, you might want to be contacted, but ignoring the behavior doesn't necessarily seem to be the right option. Why not? Well, because that behavior has a function, right? And so we want to be function based. Straight up ignoring the behavior doesn't make much sense if that's not the reason the behavior is occurring. Second, we've already put the behavior on extinction if it's in spontaneous recovery. So we've already successfully put the behavior on extinction and led to that behavior being extinct. So why would we go to ignoring when we already have a procedure we've done in the past? So what you should tell them to do is reintroduce the extinction procedure. And this goes for your technicians too. If you've successfully done extinction, the procedure was effective, and there's spontaneous recovery, well, simply reintroduce the extinction procedure. Don't overreact to spontaneous recovery. What about C? Deliver punishment on a FR1 schedule. That would be an overreaction. Again, think about spontaneous recovery as a good thing. That means extinction was successful. So if extinction was successful, we want to go right back to it if spontaneous recovery were to ever occur. And then explain spontaneous recovery is rare and that they should focus on the extinction procedure first. Well, that's just not the case, right? This is a great question by the parents, and that's one you should address. And you should simply say, if we got to spontaneous recovery, that means extinction at one point was effective. And so what we should do is simply reintroduce the extinction procedure that's already shown to have worked. So what should you tell them to do first? If spontaneous recovery were to ever occur, you would want to reintroduce the extinction procedure. You, a behavior analyst, are at your biweekly supervision session and are discussing treatment with the parent. You tell the parent you would like to introduce more choice into session, and the parent agrees. What could you introduce to best promote choice? Choice making is very important. It's empirical. It's based on research. And so choices are super important, especially when we're dealing with kids who may have control issues or kids who have behavior issues. So at your supervision session, you're discussing treatment, and you and the parents both agree you want more choice. Now stop right there. And this is what you should do while you're practicing. What comes to mind when you think about choice? Because one thing comes to my mind when I think about choice, and that is a concurrent schedule. With the concurrent schedule, we're going to have two different reinforcement schedules for two different behaviors. That way, the client or the kid, in this case, can choose what behavior do they want to engage in, what schedule do they want to contact. A concurrent schedule is a great, great way to introduce choice. What about a conjunctive schedule? Well, conjunctive schedule doesn't give choice because with a conjunctive schedule, we have an interval schedule and a ratio schedule, and both must be completed. So there isn't a choice between what schedules can be done. Both have to be completed. So it's not really a promoting choice using a conjunctive schedule. What about a token economy? Well, with the token economy, we have a set reinforcement schedule, and we're going to be consistent with that schedule. So whatever the target behavior is, that's what the learner has to engage in to receive the tokens. Now, could you design the token economy to promote choice? You could by using a concurrent schedule. right? So think about the big picture, which might be a token economy, and then the more small picture or the more targeted picture or schedule, which could be concurrent if we're trying to promote choice. And then a variable ratio schedule. On a variable ratio schedule, the learner doesn't know when reinforcement is coming because it's on an average. So a variable ratio schedule really doesn't promote choice at all because they need to keep responding in hopes of eventually receiving reinforcement. So if you want to promote choice, if you want to introduce something to promote choice, you could use a concurrent schedule. Which of the following is not true about an abative effect in applied behavior analysis? All right, first things first. What is an abative effect? It's associated with motivating operations and it will temporarily reduce the likelihood of current behavior. And it's interesting that some of these questions, if you just define the main idea here, it's going to give you the answer because we're looking for what is not true about an abative effect, right? That means when you get a not true question, 3 of these are likely true. Let's find the ones that are true. A, an abative effect reduces the likelihood of current behavior. Exactly what we said, what we predicted, that is obviously true. B, an abative effect reduces the likelihood of future behavior. Now, what reduces the likelihood of future behavior? Consequences do. An abative effect is not a consequence, it's an antecedent. C, an abative effect is typically associated with an abolishing operation. That is true. Why are they associated? An abolishing operation decreases the value of a consequence, meaning the response is less likely to occur. So C is true. And then D, an abative effect is an antecedent to a response. That is also true. An abative effect is a type of, or is associated with motivating operations. It is an antecedent. It's not a consequence. So out of our answer choices, which one is not true? Well, that's an abative effect reduces the likelihood of future behavior. All right. Thank you for watching. Be sure to subscribe. It really helps us out, and you get all of our updates. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.